Thank you for logging on to the SBIRT for Youth Learning community. We're going to be beginning momentarily. Thank you for joining us today. I'd like to welcome you all to the SBIRT for Youth Learning community, a new Adolescent SBIRT Toolkit for Educators featuring Dr. Tracy McPherson. At this time, I'd like to go over some housekeeping items for today's webinar. We'd like to encourage you all to participate in today's webinar via 3 methods. First, if you have any questions for the presenter or are experiencing any technical issues, please use either the chat box or the questions pane to communicate your questions. At the end of today's webinar will be a question and answer period, at which time I will read aloud any questions that have been submitted. Again, you can submit questions via the comments or questions box. During the question and answer period, if you would like to be unmuted and speak directly onto the webinar, please use the raise your hand feature, at which time I will unmute you and you will need to unmute your personal phone or mic. You're also able to collapse and expand the GoToWebinar panel via the button should you choose. At this time, I'd like to go through some poll questions. We'd like to get a picture of the demographics and SBIRT experience of the audience. These questions will appear on the screen as an interactive poll. Please select the answer that best applies to you. Our first poll question is, what is your current professional role? Are you a counselor, therapist, social worker, or case manager? A nurse, nurse practitioner, physician, or physician assistant? A program or unit manager? A university student or faculty, or other? Okay, great. I want to thank everyone for participating in that poll. I'm going to go ahead and share the results. Looks like the majority of our audience is either a counselor, therapist, social worker, or case manager. 28% did select other, so feel free to let us know in either the questions box or the chat panel what other profession you identify with. Tracy, I can see one that's come in already that says SBIRT Network Coordinator. For our second poll question, what field do you represent? Are you in mental health, addictions, physical health, education, or EAP? And again, if none of those apply to you, feel free to let us know in the questions box or the chat box. Okay, great. I want to thank everyone again for participating in that poll, and here are those results. So the majority of our audience does work in addictions at 46%, 27% work in mental health, 23% in education, 4% in physical health, and no one selected EAP. And for our next question, do you conduct SBIRT interventions? Okay, great. Again, I want to thank everyone for participating. And the majority of our audience does not conduct SBIRT interventions at 77%. for our next question, do you see your agency using SBIRT? Okay, great. Thank you, everyone. I'm just going to share those results with you as well. So 88% of our audience said, yes, they do see their agency using SBIRT. And our next question is, in which setting are you most likely to implement SBIRT or assist others to implement SBIRT for youth? The settings are school or school-based health centers, juvenile justice settings, job placement programs like Youth Build, primary care, or community mental health. Okay, great, thank you. I'm going to go ahead and share those results with you as well. And 41% of the audience selected community mental health, and 28% selected school or school-based health centers. And for our next question, what previous SBIRT or youth learning communities have you attended? Okay, great, thank you. It looks like we do have quite a few returning members, which is great to see. Okay, so at this time I'd just like to take a moment to tell you about the National SBIRT ATTC. We are funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, and we do offer a suite of services that you can find on our website. These include live monthly webinars on a variety of SBIRT topics. We offer technical assistance and consultation at request. And our website hosts many online resources, such as downloadable products that are easy to use, like toolkits for practice and digital tour guides. We also have an IRETA blog hosted through our parent organization that offers stories of SBIRT in the real world. All of these, as well as additional resources, can be found on our website. I'd also like to mention our free self-paced online SBIRT for Adolescents course. This course is based on a webinar presented by Dr. Sharon Levy on the application of SBIRT with adolescents, and it's hosted on our website and is approved for continuing education credit. Just a few goals of the learning community. We'd like to examine the application of SBIRT in a variety of youth settings and want to create a community of providers who have a similar interest in implementing SBIRT for youth, as well as facilitate the sharing of experiences with implementing SBIRT for youth settings. We offer bi-monthly online learning community meetings, and you can access our web page for different resources. And if you have any technical assistance, please feel free to contact us at the email address listed below. Now, at this time, I'd like to introduce our speaker for today. Dr. Tracy McPherson is a senior research scientist at NORC at the University of Chicago. Over the past 13 years, Dr. McPherson has led initiatives supported by NIDA, CSAP, NHTSA, NHLBI, SAMHSA, and the CDC. She co-leads the Brief Intervention Group BIG initiative, aimed at changing the way employee assistants and providers of behavioral health care services assess and intervene for substance abuse by adopting evidence-based screening, brief intervention, and referral to treatment practices. Tracy, if you're ready to go, I can go ahead and turn things over to you for your presentation.
That's terrific. Thank you, Sarah. All right. All right.
That looks great.
Terrific. Terrific. Well, thank you. Thank you, everyone. Thank you for joining today. It's really a pleasure to be able to share with you information about our new Adolescent SBIRT Toolkit for educators. I would just expand and let you know that what I mean by educators is it could be higher education. It could be within schools. You could be a trainer. You could be someone implementing and you're educating others in an implementation site, an instructor. You could be someone who supervises other practitioners as part of, let's say, preceptorship, field placement. So educators really is very, very broad in this context and includes a combination of practitioners who I think we're all educating the people around us, both formally and informally. So I hope you all will see that as very inclusive. And so it's really exciting to be able to share this toolkit. This is something we've been working on for probably a year and a half now, I think. And I want to thank my colleagues at NORC and that work with me on the Adolescent SBIRT project. Danielle Noriega, who has been really instrumental in helping me facilitate this project and helping us to bring this the content today and our presentation to you. And to our team at NORC, we have Sabrina Baroff and Hannah Joseph and Anna Schlessel and Hildy Cohen, and of course Eric Goplerud, who are all part of our team at NORC. So this is just not an effort of one, but an effort of many. You are certainly welcome. If you have, I'll try to answer as many questions today as possible during the Q&A, but you're always welcome to email me or call me or look me up on NORC's website and get in touch with me if you have questions about this particular toolkit or anything that we're doing as a part of our work with the National SBIRT ATTC and the BIG initiative. And as I said, you know, in addition to our team, really the work that we do and the webinars like this are really a partnership produced in collaboration with all of these partners. Being a strategic partner with the National SBIRT ATTC really helps us to bring really rich content. And so I'm very thankful to Holly and Sarah and others there at IRETA to help produce these webinars and to bring this kind of opportunities to our participants today. In addition to the materials being available on the National SBIRT ATTC, you actually already have probably seen a copy of the slides. They're posted over in the I guess that's the chat pane. You can download those. They will also, they're probably already on the webinar page on the National SBIRT ATTC website. But in addition to that, we also will have a copy of the PowerPoints on our website, and we'll have a link that will link to the recording over to IRETA's website. And we have lots of other materials and resources there that complement work in adolescent screening and brief intervention. And so we hope that you'll take advantage of those. And some other webinars that are on demand now that we did with Ken Winters and other folks who are experts in adolescent SBIRT. And those are all housed and freely available to you. So I hope you'll take advantage of those. And Sarah's already talked to you about how to use the questions pane. So I would just encourage you, if you think of something along the way as I'm talking, just go ahead and get it in the queue, and we'll try to get as many questions answered as possible. So I'm going to start off just, you know, for some of you, you may not be familiar with this project that's led to the development of this toolkit and the curriculum. It's called the Integrating Adolescent SBIRT into Social Work and Nursing project, but what we found is it really has now expanded in just a year and a half to include interprofessional education. Some of the social work and nursing programs we originally began working with are collaborating now within their academic programs in other areas of medicine, other areas of psychology, and so it's really growing, and that's very exciting. I want to acknowledge the Conrad Hilton Foundation, first and foremost, for giving us what an incredible opportunity and trusting us to be good stewards of the work that they want to do to reach their strategic goals and to really educate the new workforce and really bring education and training to the current workforce. Part of their mission is to really reach both the budding practitioner and the existing workforce, and we are very thankful to them for giving us the opportunity to do this and to make the learner's guide and the toolkit materials on the website that I'll show you available for you at no cost electronically. And then our partners, of course, you cannot put a curriculum together without bringing in the experts in clinical social work and social work education, within nursing education, experts that are experts in adolescence and substance use, and of course our technology partner who helps us complement the toolkit with a simulation training that allows interactive experiences around learning. And so the website for this project is www.sbirt.webs.com, and I hope you will, I'm going to give you a little tour later, but I hope you'll visit us and take advantages of those resources. And just to give you a little bit of an overview of what I'm going to talk about, I'm not going to go into a lot of the background around screening and brief intervention or the evidence around adolescent SBIRT. I'm going to kind of highlight a couple of things to let you know where we were coming from when we began this journey of putting together a curriculum and a toolkit of materials. And so our conceptualization of what is SBIRT and sort of why adolescents and what the goals were that we were trying, really aiming for, and provide a little overview of the project, a couple of challenges and gaps that have emerged as we've been developing the curriculum and listening to the educators and instructors and practitioners out in the field, give you some snapshots of the curriculum and the toolkit, and some highlights of the simulation platform that complement the toolkit materials, and then we'll do a little Q&A. So here's the model that we're using. We needed a model, a conceptual model, to guide how were we going to develop a curriculum of materials. And we adopted SAMHSA's definition of screening and brief intervention and referral to treatment. And really, for us, though, the importance was, the focus was early intervention. We weren't really aiming to educate folks on how to treat a substance use disorder in adolescence. We're really trying to get, we're on the other end of the spectrum coming into this in terms of prevention, early intervention, screening routinely for not just alcohol, but marijuana, potentially other substances, including tobacco, and then identifying tools that help you understand the level of risk, so where along that risk continuum might we be able to prevent and intervene early and deliver the right level of brief intervention at the right level of risk, recognizing that we could potentially be offering tools that would identify, and of course we did include those, that for those adolescents who might have a substance use disorder and would need further assessment. So this is the model that we used. We do walk through every single component from screening to brief intervention and referral to treatment, and talk about treatments that are effective, driven by the science. And we've adopted the brief negotiated interview model in our curriculum. And so I hope that helps you to get a sense of kind of the framework from which we were operating. Of course, woven into this is motivational interviewing. So we are really, our aim was to educate practitioners and to help educators train budding practitioners to use the brief negotiated interview model woven in with motivational interviewing skills and to use validated screening tools to help increase the early identification of adolescents at risk for a range of substances. and to offer the brief negotiated interview model and the conversations and the dialogue that might go into a brief intervention to help build awareness and educate adolescents around the risks, the recommendations around the use of substances, which, as we know, for adolescents is 0. Those are the guidelines. And then to use motivational interviewing strategies to engage adolescents in a conversation with the aim of reducing risk, to encourage them to engage in healthy behaviors, to reduce their substance use, and to adopt more health-promoting behavior. And then in cases where a higher level of care was needed, to motivate adolescents to seek help, engage parents and caregivers as appropriate, and it creates the access or the delivery of adolescents, delivering them to care when they needed a higher level of care. And then overall fostering a continuum of care and equipping practitioners and to really think of it from prevention, intervention, and engaging the adolescent into additional healthcare services or treatment services, and addressing substance use as a part of the whole health of the adolescent. So it seems so obvious why it would be important to address substance use and for adolescents, but we haven't done a lot of that historically. We really haven't educated the workforce to be prepared to address it with adolescents. And I think we all are convinced that there are lots of great reasons between neurological development, brain development, the risk associated with early initiation of substance use, increasing risk of likely developing a disorder later in life, can lead to other associated unhealthy behaviors. But all of those things are true. The thing is, we don't often ask adolescents about their substance use, so it goes undetected. The risk factors go undetected, and we don't have opportunities to talk with adolescents about the why they engage in substance use, where it fits into their life, and what are the risks associated with it. And so we try to develop curriculum content that would help practitioners really have these difficult conversations. So the current workforce may or may not be aware. I think if you're a pediatrician, you know that the American Academy of Pediatrics recommends screening and prevention for adolescents. You may or may not if you're a physician or you are associated with another medical association that it's recommended. What we do know is it's not currently a U.S. Preventative Services Task Force recommendation as routine practice for every adolescent in every setting. But despite that, many leading associations, organizations, and government agencies such as SAMHSA and NIAAA and CDC and CMS as a part of their the early child care well visits, for example, have recommended that we're engaging in screenings adolescents, and that includes the young adults, to ask them about their alcohol use, marijuana use, tobacco use, and other use. The challenge that we've really had, and some of the rationale for this project, has been that there's been such slow uptake among health professionals of SBIRT in general, but in particular with adolescents. Very few young adults, adolescents report that they've ever been asked by a health professional about their substance use, and many providers don't routinely screen. The future workforce that's budding and coming out, we've had incredible support from SAMHSA and HRSA and other agencies really trying to educate pre-service professionals who have traditionally not been exposed to this kind of content in their formal academic training. And all of that work is very, very necessary, and we need to be doing more of that, and I hope our agencies will continue to support that work. But to grow it to scale, we need foundations, we need communities, we need lots of other places. We need other mechanisms for bringing the education to scale, and that's what this project has done. The Conrad Hilton Foundation is contributing to this effort to bring it to scale so that we are preparing social workers and nurses and psychologists and counselors and addiction professionals and anyone who works with adolescents and young adults wherever they receive care to be prepared to use a validated screening tool and to conduct brief intervention as appropriate. These are some of the places where professionals like yourselves and those who are working with us on our project are working right now and implementing SBIRT. Some with adults, some with young adults, some adolescents, some are trying it with all different age groups. But these are just some of the places we're seeing it and where we're hearing from our colleagues in our project and our learning collaborative is where their students and their practitioners and their supervisors and their preceptors are maybe working and overseeing work where screening and brief intervention is happening. And so we're trying to develop really a curriculum that it could be used by professionals and adapted in a way that fit with the kind of context that they're working in. So we have a website for the project, as I mentioned, the sbirt.webs.com website, and integrating adolescent SBIRT into social work and nursing education. But even if you're not in social work and nursing education, I really hope that it won't discourage you from visiting the website. I think you will find it has very interprofessional feel to the materials that we're offering. We do have a learning collaborative that has social work and nurse educators and instructors and programs. I do hope in the future, though, that we were going to grow this. Our learning collaborative eventually will include practitioners from a variety of different disciplines. I really think this can benefit a full range of disciplines. So I hope you'll read a little bit and check us out on the website and learn more about what we're doing. But I can tell you this, the aim really is to engage for us. It was, if we're going to develop this toolkit and this curriculum, we needed to engage the leading national associations, the experts, the practitioners, the students, the researchers, the accrediting organizations to help us develop this so that we're not developing something for people or for educators or practitioners, we're developing them with them. And another way of doing that is not just to have an advisory panel or steering committee, but have a learning collaborative that can help foster the development of the materials, help us with understanding what do they need, what do they want, what would help to make it easier to integrate the toolkit. And so they are in the process of now, they've developed it with us, they're implementing it, and now we're evaluating the implementation of it and providing technical assistance with it. And we will continue to grow this curriculum. So as you see these materials and you see something that is not there, you're thinking, well, I would really need X, Y, and Z. We want to hear from you because in the summer, we're going to expand this and include more materials. So always welcome, even if you're not participating in a learning collaborative and you just want to say, hey, I need something specific to marijuana use among adolescents in drug courts, for example, or wherever. That's really helpful to us, and that way we'll know what we can put into the pipeline of things that we can develop for you. So here is the website, just a highlights of what you can find there. All the materials that we're going to talk about are linked to this website, and many of them you can download, which I'll show you. In addition, we have a library of resources, so I will show you a little bit of those. And if you are interested in the Learning Collaborative or becoming part of it, you can read about what we've discussed in our Learning Collaborative, what we're sharing in our Learning Collaborative, because we put all of our meeting notes in there, including presentations by folks like Stephen Strobry from University of Michigan, who actually has described his program and how they're implementing this curriculum into their program. So there are tidbits in there of how did they apply this curriculum into their actual programs or the training that they're doing. So a lot of other resources there. And of course, all the materials for the Adolescent SBIRT curriculum are there. So this is kind of our reach of where we're seeing people who are interested in the curriculum. I just show that because it's been wonderful to have more than, I think, 250 requests now for this curriculum. And we're hoping that you too will be interested in implementing it in your setting. Right now, our learning collaborative that has helped us develop this curriculum has grown to over 70 schools and more than 150 educators. We are taking their opinions and information and their experiences with the curriculum, and we're integrating it and thinking about what do they need and what we're going to develop. And we have more than 30 subject matter experts helping to revise. Some of those folks are on this call now, and so I appreciate Brett Harris and Holly Hagel, who are going to be helping us continue to grow this and even make it even better than it is. And we have a lot of other folks in this space that are going to be helping us to continue to grow. So as we thought about developing the curriculum, these are the things that we heard. There's a lack of time to add something else. This is not required education, so why should I integrate this? I don't have time to do this. I don't have the awareness, skills, knowledge. I don't have the materials around adolescent substance use or SBI. I don't know where to start. I don't know what to include. I don't know what resources and teaching materials are available. And I'm not sure where it fits in. Is it a separate course? Is it an addiction-specific course? Do we weave it into an adolescent developmental course? Where do we put it? So we're really trying to develop a toolkit that answers some of these questions, some of these concerns. And we heard there's a lack of engaging visual learning opportunities when they're doing lectures or they're training practitioners, that it's death by PowerPoint, and they wanted things that, you know, audio and video, and we're developing a simulation, or we have already developed a simulation to complement the curriculum. We also heard that often the what's out there is really developed for people who are working with folks who have substance use disorders, that the materials haven't been designed to be more prevention, early intervention, that most of the materials they've seen or where the education is taught is framed in a psychiatric mental health framework rather than a broader sort of public health across a variety of different health issues. So they wanted to make sure the curriculum just wasn't speaking psychiatry and mental health. They also said there's limited time and exposure to the content. So what they wanted was they wanted the ability to have a comprehensive deck of materials, and they also wanted to have the materials sliced up. So you have a full curriculum with a full PowerPoint of everything, but then they wanted a 1 to 2 hour training content for a presentation of about 1 to 2 hours, something for 4 to 6 hours, something that could be fit in when you have limited time, or that you're trying to break something up into multiple sessions over a course. And so we try to meet that need by developing things in different ways, of different lengths and different levels of how comprehensive something was. And they said there were so many competing demands and lack of resources and expertise and materials. They said, you know, if you could just create it for us and make it easy for us to do it, we're more likely to do it. So that's essentially what we did. So let me give you some highlights of how we try to address those gaps and what we try to really develop with our learning collaborative and with our steering committee. So it really was designed to, you know, of course there's knowledge to be gained, but it's not just knowledge. We were really trying to go for sort of a skills-based educational approach. We can throw a lot of knowledge at people, but people need opportunity to practice. They need exercises to practice. They need feedback. They need means of monitoring fidelity and quality and providing performance feedback to build skills. And so we really tried to take that approach in the materials we selected for the toolkit. So the toolkit that the curriculum overall, it really contains 2 pieces. So there's an instructor's toolkit, which we'll talk about, and then the companion piece in the curriculum is the interactive adolescent simulation training program. So the toolkit itself, everything in the toolkit is available absolutely at no cost to anybody who would like it and wants to request it. And it includes the learner's guide, which is a complete comprehensive educational and training guide, and it has a complete slide deck that aligns literally from start to finish with the exact way that the modules in the learner guide are presented. And then it has all the supplemental materials that are referenced in the learner's guide are also referenced in the companion slide deck, and they're available from the website, which I'll show you. And then the web-based simulation program, we have some snapshots of that I can show you. We have a downloadable flyer that gives you more information that is designed to complement, not duplicate, what's in the learner's guide and toolkit. And it will actually give those who are the learners an opportunity to practice and get feedback and have a competency assessment. So we provide tools on screening for alcohol and drug use, all validated tools. We really focus on delivering brief interventions using BNI with motivational interviewing skills. So there's a whole module on brief intervention, but an entire module on motivational interviewing. And then a section on referral to treatment, but more about linking people to care. How do you link them through warm handoff, through more of the best practice guidelines to medical, behavioral, other specialty care, and also how to work in ongoing care coordination. And so there's some tools and resources specifically about that. And then how to do follow-up and recovery support and resources that can provide more information around how to support adolescents and young people in recovery. So as I mentioned, we've engaged a lot of experts and learning collaborative members, and we also had an online review group of the students and practitioners who really helped to inform this content. And we also did beta testing to test the content and get reactions, doing a kind of an iterative development process to develop the materials I was just talking about. So if you visit our website, you will see that everything is really housed primarily on the curriculum tab. So I'll show you that in a minute and kind of tool around there. But the curriculum tab is set up to the top of it shows information about the simulation. It has a downloadable flyer, and it describes what's in the simulation. And as you go down further on the page, you see the Instructor Toolkit. So here you're going to be able to click and request a copy of the toolkit. You can request, if you want it, a copy of the PowerPoint slide deck. And you'll see that the way that the curriculum is organized, every module, starting with an introduction to screening and brief intervention, going through Module 2 for screening, Module 3 brief intervention, Module 4 is motivational interviewing, and Module 5 is referral to treatment. And you're going to have all of the links to the supplemental readings. You'll have links to the tools. All of it you can link to from this page. So let me give you a snapshot of the learner's guide. So this is what it looks like, and it's comprehensive, and we're covering adolescents and young adults from age 12 to 21. There are case studies in there, and there are practice exercises that complement the information in the toolkit. And then the aim is to really get students and practitioners who might be going through You can also order a hard copy version. There is an order form that is available for you to do that, and that is made available at cost. We make nothing off of the cost of it. It's the printing and shipping cost only. So here you go. Here it is. Here's how it's laid out. And so you have comprehensive lessons for each module. You have suggested readings for each module, and you're going to have sample conversations and dialogue, and I'll show you that in a second. They're fully scripted out by our experts, and they can be used as an engagement tool. So if you are educating and training others, you could use it as a role play exercise, or you can have it as a self-paced kind of learning, self-directed exercise. But it actually will help the learner practice the words and have the sample dialogue, and we find that helps them to be more comfortable, whether they're new at this or they're a seasoned health professional. We found that having the scripted sample interactions is really very helpful. And then you have role plays for each one of these modules. And a minute ago, I said Module 4 was MI and Module 5 was referral to treatment. I meant the reverse. It actually goes screening, brief intervention, referral to treatment, and then motivational interviewing is Module 5. But anyway, the modules are independent. So you could, they're designed that you could teach one module, you could teach 2 modules, 3 modules, you can do them in whatever order that you want. And so it can be done as a full day, or you could break the content up over multiple events. So here's an example of Module 2. So in the learner side, it will lay out the learning objectives. And these are the tools that we are covering in Module 2, and these are some of the common tools that are out there. But we put them all in one place, and we literally walk through every tool and how to score it and how to interpret it. And we line up the suggested readings that we think match the learning objectives and also support the content that would be in that module. So we do the same thing for brief intervention. We go through every single step within the brief negotiated interview. We provide suggested readings to complement learning about brief negotiated interview, and then we script out the brief negotiated interview. So in Module 2, you'll have a scripted screening for these tools, and in Module 3 for brief intervention, you have scripted brief negotiated interviews. And then referral to treatment, you're going to have scripted a dialogue around referral, and the same for motivational interviewing. You'll see brief interventions using motivational interviewing and highlighting the micro skills, the ORs, and the other basic principles that are within motivational interviewing are highlighted throughout that module. So we also, want to provide you some background information. We try to select tools that were all publicly available and free, and there are some that are, you can get sample copies for free, but for example, the Gain S is actually one that you would have to have a licensing fee. But so we try to balance it between making most of them publicly available, and then we really needed to include the Gain because this is a very well-respected tool that many people are not aware of. It's been used a lot in clinical trials supported by NIH and has a lot of normative data. So I hope that this kind of module, this kind of curriculum offers different resources for different age groups and with then different settings, so you have choices. And that's basically what we tried to do, is to give you choices, but to try to be comprehensive. The role plays, we are providing a role play around the screening. Every screening tool, they're a role play. And so we found that role plays are very important, and we try to script, give some case examples of how you could frame the role play. And our colleagues at the National SBIRT ATTC are going to be working with us over the next several months. We'd like to enhance our case studies and our role plays. There are a lot of them in there, so you have lots of options, but we're looking forward to expanding those. Copies of them are included in every module, as well as you'll find blank copies of the actual tool in the appendix. And if you're in the brief negotiated interview module of brief intervention, you will actually have copies of the BNI algorithm, and you'll have blank copies so that as you're learning, or whoever you're training can actually go through a role play exercise and have the brief negotiated interview in front of them. So it allows everything to be just easily in front of you. And here's an example of a sample interaction. We have sample interactions, as I mentioned, with all the different screening tools using brief negotiated interview. We try to vary the gender and the age and the presenting problem. It could be a behavioral health problem. It could be a physical medical health problem. Could be an adolescent coming into a clinic or a school health center. We really tried to vary it, yet even if you took away exactly where the setting is, you would find that the interactions actually could be applied in a variety of settings. And then we try to highlight the different skills that are being taught in the module, so around your ORs, the reflections and the affirmations, to help the learner and the trainer or the educator know what we're really trying to highlight in that skill. So in the appendix, you also find that all copies of the screening tools, including the sample copy of the GAIN SS, but the CRAFT and the S2BI and the audit. And many people don't know this, but there is a version of the audit that has been adapted for adolescents. Now, it can be used with young adults, of course, but people are, I think that'll be a surprise to some folks, that the costs are lower, but we also have the traditional tools that in there, more about further evaluation assessment. How do these tools line up with DSM criteria? So we include a handout available on that. We have goal setting exercises that you could use with an adolescent or a young adult. We have change plan worksheets, all available that you can photocopy freely. We have materials on mutual support groups that are specific to young people. And we have brief observation sheets, or what I call bios. And you can use these in a couple of ways. So you could be supervising someone and monitoring, giving feedback and on their performance. You could use that as an observation sheet to look at fidelity and quality of the simulation or the role play or the standardized patient interaction. Or you could create dyads and triads in your practices and have a third person watch and observe the role play and provide feedback and on how that role play went. And you can use it as a very constructive learning tool. Some can also use it as a performance feedback tool, but you'll have copies of those that allow you to kind of go through and, you know, and sort of check off all the things that have happened in that observation. We also have brief intervention observation sheets that will allow the educator or the trainer to rate motivational interviewing skills, and these are standard. These are tools that we didn't make them up. We used what has been used in standardized patient simulations, where they rate the use of certain motivational interviewing skills on a scale, and so we've included those. Those are publicly available. And of course, I mentioned we have additional case studies. The Bernsteins were kind enough to let us integrate their case studies into our appendix. So what you would find on the BNI Art website, they were able to let us integrate those, as well as some others that they had in the work they're doing to train the next workforce. We also have sample release forms. We have sample client update reports. We have decisional balance worksheets, and we have pocket cards, like where can you get a craft pocket card? What does that look like? We have materials that could be printed and laminated, some that come from the National SBIRT ATTC that are you know, up on the website, things that come from NIH, things that are publicly available, and trying to pull them together into this toolkit so that it's kind of like a one-stop shop, we hope. And I would say as you're using it, something that's not there, you should definitely bring it to our attention so we can include it. And as I mentioned, the comprehensive slide deck really aligns with all of it. So, you know, if it's in the learner's guide, there's going to be a slide that has that information on it. And it's available in PowerPoint format. So we did not PDF this, as many people do who own their own PowerPoints, because you can't edit them. And so we wanted to make this easy, so we will give it to you in PowerPoint format. It is fully scripted out, so if you're a trainer, you could use it to fully deliver the entire learner's guide. But then what you can also do is you can set that copy aside. That's your deck, but you could create what I call a delivery deck. So if you don't like having all the words on the slide, you can trim it down, make it your own. And so some people like to have a lot of words, some people don't, but I wanted to mention that because eventually what we're doing is we're going to have two versions of the slide deck. There's the fully scripted version, and then there's going to be sort of an abbreviated version. So you'll have higher level bullets, but you won't have all the talking points necessarily on the bullet, on the slide, but you would have it in your copy. So you could be able to deliver it and have your notes in front of you. So again, trying to make it really easy for people. We've also pulled for you too, things from reputable, credible resources. So if you want to use them in your slides, like the NIAAA, they have a lot of nice graphics and visuals about how to present risk, and when you're training and educating other people to understand the risk bands. We try to really grab some high-quality visuals that are from credible resources so you don't have to recreate them yourself. And here's just kind of another example of, I showed you what was in the learner's guide around a role play exercise. You're also going to have the same identical role play exercise in that sample slide and in the same order as it's presented. And just here's a kind of a snapshot, where you're talking about whether it's confidentiality or you're asking permission or whatever the dialogue is when you're trying to facilitate a brief intervention. We have these sort of thought bubbles and dialogue bubbles that allow people to either you deliver it to help the learner have the scripted out, some scripted dialogue, or you could actually have them practice, with this dialogue in a role play. And then so here's how to order it, and I'm going to show you the website in just a minute so you can get a little bit of interactivity, and then we'll have probably about 5 minutes for questions. But I encourage you to order it. Again, it's $30 at cost for a fully printed, high-quality color copy plus shipping, but electronic is free. You just complete the order form, and it comes to me, and I email it to you. It's pretty simple. And then I'm not going to go into this in detail, but I wanted to encourage you, if you're interested in the interactive simulation program that we've developed, which is a companion to the toolkit, I would encourage you to go to and visit the website. You can get a sense of what the digital experience is using virtual patients and clients that have real emotion and body language. And we went to painstaking links to make sure that the students and the learners could really identify with the different characters. It really is based on neuroscience and virtual human technology that's state of the art. And it's very customizable so that if you're a nurse or a social worker or a counselor, you can select, what kind of provider you want to be. It's really a very, very interesting and fun experience, as well as an educational experience. And so a lot of science, and it's really a science-driven approach to this virtual patient simulation training program. And all of our partners helped us to develop this. And we're going to be putting up some demo links. You can see some things on the website now that are kind of flashing around. You can see images, but we're going to put a demo up. And it essentially has about 3 different conversations. It has a hospital setting, it has a school nurse setting or social work office, primary care. They have some are injuries due to alcohol, some may be a well visit, really trying to modify the different scenarios. Some include alcohol, some include marijuana. It also has a competency assessment at the end that will actually score the learner on their overall performance in using a brief negotiated interview and a motivational interviewing style. So you have the slide deck, and you can look further later if you want to know a little bit more about the feedback and the analytics that, that go into the program. But it really is a nice complement to the curriculum itself. So I am going to exit out of this, and I want to show you a couple of things. So here is the learner's guide, and what we've done is tried to make this easy. Sarah, is this visible to you on your end?
Yep, it looks great. Thank you.
Terrific. So you'll have a table of contents, and it will link to everything in here. So use the table of contents to help guide you. But it will, Module 1, you can see it lays it out so that you can quickly get where you need to be within the learner's guide to the learning objectives. It goes through and it gives a background of, what is SBIRT and why use it. So you're getting that introductory foundational level. And it goes through into, the rationale of risky youth alcohol use, and has all the citations you could ever want, and all of the references and links to the articles as well from our website. And every module has a summary of, or at least what we try to do is take the takeaways and align that with the learning objectives. And then you can click into the screening tool and you can see we talk about how do you ask the questions. We give dialogue around how to ask the questions. We go into the craft screening tool and how to score it. And then we have a role play. And then we present the audit, and we go into the background and how to deliver that, how to score the audit. And again, we go into the GAIN and the S2BI, and we do it pretty systematically. And each one of these offers their own case studies and role plays. And so I wanted to show you this since we didn't have slides on this. But for the brief intervention module, here's what we go into. We try to provide some high-level content, but around building rapport, talking about pros and cons, exploring pros and cons, using reflective listening, using summarizing, providing feedback, how to ask permission, how to provide educational information and engage adolescents in a conversation around substance use and eliciting their own ideas, how to use the readiness ruler and the readiness scales, and negotiating an action plan. So we've worked through all the components of negotiating an action plan, and closing the conversation in terms of summarizing and thinking. And we have, so you can see it really does align with the way brief negotiated interview model is delivered. And then you can see we have a lot of components here around motivational interviewing and referral role plays. And then working with physicians and ongoing care coordination, how to make phone contacts, and we do follow-up, we have follow-up role plays, how do you actually do follow-up. And then we go into the motivational interviewing strategies, as you can see, and we break them down by the different micro skills. And so there's a section on each one of the micro skills. So last but not least, before we take a few questions, here is the curriculum page, and we are there. And this is where I was showing you some screenshots. You can see that there are some rotating images of the simulation program. And here is where you can download the product information sheet. And this is where you would go, right here, to request a copy of the learner's guide and request a copy of the PowerPoint. And here is where you can click on and get all the suggested readings, anything that is in the public domain, or those we've had been given permission to actually include. And then we have them for every section. And last but not least, we have a sample syllabus. So if you want to teach a course, there's a sample syllabus. We're offering pre-test, post-test sample evaluation measures. And you can quickly link to blank copies of these different screening tools and the BNI algorithm and some of the BIOS sheets I was talking about. So I'm going to stop there and see if we have any questions.
Okay, thanks. Great job, Tracy. We just have 2 questions that have come in so far. So I just want to remind the audience, if you do have any questions, feel free to submit them to the questions box or the chat box. So the first question, could you just talk about a little bit about the length of each module?
Yes, I'd be glad to. So what we did is put together a comprehensive course, which is much like an accordion. You could either try to deliver the entire thing as a one-day full workshop, or you could, for example, you could easily pull to teach, to pull an hour, so let's say for screening, if you just want to do a high-level overview, you could pull content to create an hour overview. So it really is, it's designed to be an accordion. So if you don't want to teach on all the micro skills, for example, of motivational interviewing, you can pull out where you want to just teach, about 2 or 3 of the micro skills. So if you delivered the whole thing, you could make it as long or as you want to. You could technically deliver it over a full day or 2 days if you do the rich case studies and the feedback. But what we're finding is people are really adapting it. So if they have a 45 minutes, they will pick and choose to fit their time limit.
Okay, great. Our last question is, why don't you include the -10 as a screen?
The -10 actually in the next version will be included. We will be including the -10. We will also be including some other tools. If you're the APA emerging measures that NIDA has up on its website, those will be included as well. And so they're in version 2, which we're working on this summer. Those will be there, as well as scripted sample interactions and case studies. So they are going to be coming in the next version.
Okay, well, thank you so much, Tracy. That was a great presentation. If anyone does have any remaining questions, you can feel free to submit them now, and we'll share them with Tracy after the webinar and then share any of her responses. Tracy, I'm just going to take the screen back from you and talk about some of our evaluation CEUs.
Great.
Okay, so thank you everybody for your participation. First thing I'd like to talk about is the participant feedback form, which they have already received information on if you've attended one of our learning communities previously. We are looking to improve our learning community going into 2016 here. So in your follow-up emails from today's webinar, there will be a link to the participant feedback form. If you could take a couple minutes to complete that survey, it provides us with really valuable feedback and suggestions. And you can also complete part of the survey if you'd like to be a guest speaker on the learning community. As far as our CEUs and evaluations go, you're going to receive 2 emails from us following this webinar with links to the recording as well as a PDF version of today's slides. And you're also going to get a link to the evaluation. Now, our grant evaluators are required and pleased to collect feedback from all event participants. Completion of this evaluation is critical to maintain our funding and continue to provide quality education and materials. Your participation is appreciated, and the evaluation should take no more than 2 minutes of your time. Immediately following the evaluation is a request form and instructions on how to get your certificate of attendance or a NADAC or PCB CEU. It'll look like this page here. Now, if you just want your certificate of attendance, you'll just need to come down here to this link, which will take you to your My IRETA profile, where you'll be able to download the certificate. If you'd like a NADAC or PACADC certificate, you want to click on one of these purchasing links here, which will take you through a free purchase process. There's no charge for these certificates, but it will ask you for some of your contact information, which is required for these agencies. Once your order is complete, you want to just go back to your user profile, where you should see your certificates available for download. You'll also have all of your certificates from previous webinars that you've attended with us available here. Now, don't forget to register for any of our upcoming webinars. We will be hosting additional learning communities. You can visit our learning community webpage. Those dates are to be announced. And again, we want to just thank everyone for their participation today. If you do have any additional questions following this webinar, please feel free to email us at info@ireta.org. Okay, thank you everyone, and thank you, Tracy.
Thank you.